Hello, my name's Nicole. I'm a student midwife, and today we're going to be talking through the signs of labour, what you can expect, what you should do when you experience these, and most importantly, when you should call your midwife. So the three main signs of labour are contractions starting, having something called a show, or your waters breaking, and we're going to talk through each of these individually now. So first of all, having a show. You might also hear this called a mucus plug. So what is it? If you imagine that this is your womb or your uterus, at the bottom of your uterus you have your cervix, and this is tightly closed, it's thick and it's long during pregnancy, helping to keep your baby inside and safe. The mucus plug sits inside your cervix and it's there to prevent baby from getting things like infections. It's a sticky jelly-like mucus and it's a pinky colour. And it's a pinky colour because it's blood stained, and this is completely normal. However, if you do feel like you're losing more blood, you should call your midwife for advice. Losing your mucus plug is an indication that your cervix is starting to soften and open up, which is great news because that cervix needs to open up nice and wide to allow baby to be born through it. Your mucus plug might come away in one blob or it might come away in a few pieces. Not everyone will have a show at the beginning of labour, it might happen later on, and you might not even notice you've had it because it might just flush away down the toilet when you're on the loo. Labour doesn't always start immediately after you've lost your mucus plug, it can take a few days. For other women it will start sooner afterwards. The second sign is your waters might break. You might also hear this called ruptured membranes. Your waters are a bag of fluid that surround your baby during pregnancy, and these help keep your baby safe from knocks and bumps. You might also hear the liquid called liquor or amniotic fluid. And this bag often breaks when baby is ready to be born, and this is when you might notice fluid draining out through your vagina. Most women's waters don't break until labour has already started, but if yours do, you might notice that it's a gush or a bit of a trickle, and this just depends on baby's position or where exactly the bag has been broken. If it's broken up further up, you might just notice a bit of a trickling because the water just comes down the sides of the womb rather than a big gush at the bottom. Your waters are normally a clear, pale straw colour, and if you think your waters have gone, pop a pad on and this will just help your midwife check if your waters have gone, and ring your midwife for more advice. If your waters have gone and they've gone onto your pyjamas or your clothes, take those in with you too because it will just be a help to your midwife so that she can check if it is your waters that have gone. Don't use a tampon, just a pad. If your waters are smelly, coloured, kind of a greeny dark colour, or you're losing fresh blood, also make sure you contact your midwife immediately. The reason we want you to contact your midwife if your waters have broken is because there is a small risk of infection, so we just need to make sure that we have a plan in place in order to keep you and baby safe. So thirdly, let's talk about contractions. So contractions are the tightening of your womb, and these help open up your cervix at the bottom of that entrance at the bottom of your womb, and they help push baby down as well. They come in waves, and as labour progresses, they become stronger and longer. These early contractions are called the latent phase of labour or early labour. As your contractions become stronger, you might find that you find it more difficult to talk through them and that you need to pause and concentrate. When your contractions are regular, lasting around 60 seconds and coming every 5 minutes or so, you should call your midwife or maternity unit for more advice. So lots of women ask about Braxton Hicks contractions. Braxton Hicks contractions are when the womb tightens and relaxes, and they're sometimes known as practice or false contractions. Not all women will experience them, but if you do it tends to be towards the end of pregnancy. And they're not painful, but they do tend to be uncomfortable. Braxton Hicks contractions won't open the cervix, that opening at the bottom of your womb or uterus, like contractions will. But you can tell the difference as contractions are regular and frequent and they become stronger and longer as time progresses. However, Braxton Hicks do not do this. They're not regular, they don't increase in frequency and strength. If you're not sure if you're experiencing Braxton Hicks or contractions, please call your midwife for more advice. You might also find you experience backache similar to the pain and discomfort that you might get when you're on your period. And you may also find that you feel the urge to go to the toilet. And this is because as the baby's head descends, it can press on your bowel, giving you that sensation. So just to recap, you should call your midwife if you think your waters are broken, if your contractions have become regular, lasting 60 seconds and coming every 5 minutes. You should also call your midwife if you're bleeding red blood, if your baby's not moving as much as it usually would in its normal pattern of movement, if you're less than 37 weeks pregnant and you think your labour has started, or if you're not sure if you're in labour, just give your midwife a ring and you can chat to them about what's been happening. If anything is worrying you at all, please do always call your midwife for more advice and reassurance. I hope this video has been helpful and informative, and once again, congratulations on your pregnancy.